Well, a stroke can happen to anyone really at any time, so it's important to know how to recognize the symptoms of a potential stroke. It's also important to know how to help prevent strokes, because May is Stroke Awareness Month. Singing River Health System Rehab Program Coordinator Wendie Hawkins is here to share some tips that really could save your life. So thanks for being here today, Wendie. And this is important, of course, for everyone to know. First of all, I think the symptoms, because I mean, you never know if you might have a problem or someone you love or someone you're with.
Thanks for having me, Karen. You're right. Everybody knows about heart attacks, but now these are called stroke attacks, and we need you to know the symptoms of a stroke so you can get to the hospital as soon as possible to reverse those symptoms. And we use an acronym, Be Fast. It's easy to say,
Be fast. And that's what makes you think of the, like, B is for balance.
If someone's falling, they could have a cerebellar stroke, and they could be leaning to one side, always falling to one side, but it doesn't have to be. They can be falling to either side, just at a tactic, uncoordinated type of movement.
And E is for eyes, if you have a change in vision. Face is for weakness in the face.
E, we put that in there. It used to just be fast, but E is for, like if someone is doing normal and all of a sudden the light suddenly bothers them, and it's just excruciating pain due to light.
Okay, yeah, and we went face, weakness in the face, arms, sudden weakness of an arm or leg. We have short time, so I want to get to some other things.
Yes, ma'am.
Speech, sudden difficulty of speaking, and time the symptoms?
Okay, they have the time of last known well.
Okay.
So time is the penumbrum. So if you can get to the emergency room, they have 4 hours to give you a medication called TPA that can reverse the symptoms.
And that's important.
Yes.
And what about prevention? I know we're going to talk about rehabilitation too, but I think prevention is really important.
Well, you have some problems that are inherent to each person, regardless of race, religion, creed, or anything, that you can't change. But then you have also factors that you can change, like smoking and your diet and how you eat, and medication and your blood pressure and your heart rate. If you have atrial fibrillation, it can place you at an increased risk for strokes.
And I think it's important to let people know that if you do suffer a stroke, I mean, rehab has come a long way, and rehab really can make a difference in quality of life. People should really, if at all possible, stick with their rehab programs.
Yes, ma'am. The American Stroke Association, if you've had a stroke, they recommend acute inpatient rehabilitation. And up at CRC in Pascagoula, we have a tracker app, so if your family does not live here or they can't come see you very frequently during your rehabilitation to see the progress, we have an app that your family can log on, and it's a combination of Facebook and Instagram, so you can they can see the progress.
Okay, good. Again, Stroke Awareness Month, and Wendie, thanks for being here from Singing River and giving us some great tips.
Thanks for having me.
If you